Hi, my name's Katherine Armour, and to highlight the fact that it is Rosacea Awareness Month, I wanted to talk to you all about my approach to treating rosacea. Now, this really common and often a very distressing inflammatory skin disorder affects about 1 in 20 Australians. It's really a complex interplay between problems with your epidermal barrier function and inflammation that occurs deeper in the skin. And to get rosacea under good control, we really need to take a multifaceted approach, looking at sun protection, skincare, cosmeceutical ingredients, often prescription treatments, and also energy-based treatments in some individuals as well. So first and foremost, top of the pops, sun protection is absolutely crucial in rosacea. Now, this is often difficult and many rosacea patients shy away from using sunscreen because they find many sunscreening agents irritate their skin, and particularly chemically based sunscreens, or what we call organic sunscreens. So it's really important that you speak to your dermatologist or dermal therapist about finding a sunscreen that is appropriate for you. The reason for this is we know that UV light exposure actually helps precipitate or drive the inflammation that can cause rosacea. So I tend to find that the sunscreens that are best tolerated are physical or inorganic sunscreens, which are those based on zinc oxide or titanium dioxide. So after sunscreen, we come to skincare, and this has to be gentle. So I'm talking about gentle, nourishing moisturizers and gentle cleansers, no foaming cleansers. Foaming cleansers are just going to irritate your already very sensitive skin and rosacea and disrupt the epidermal barrier further. So think milky cleansers or light kind of wipe off cleansers, and please feel free to DM me or write in the comments if you'd like any specific brand recommendations. I won't discuss them here. Then we can look at cosmeceutical ingredients that are really useful in rosacea, and by far and away my favourite, and I think the favourite of most dermatologists, would be niacinamide or vitamin B3. And niacinamide is so useful in treating rosacea because not only is it anti-inflammatory in nature, but it helps increase ceramides, which are a really important component of the epidermal skin barrier. It increases skin barrier proteins and generally soothes inflammation. So we should all be getting niacinamide onto our skin. And again, very happy to give you brand recommendations if you wish. We know that the Demodex follicularum mite that lives in many of our oil glands and around hair follicles is really important in some people in driving the inflammation of rosacea. And it has certainly been noticed that by applying topical ivermectin, also known as Soolantra, that this can really decrease the number and frequency of papules and pustules in those with inflammatory rosacea. For people who have severe fixed redness as a result of their rosacea, topical bromonidine can also be really useful, and this can be prescribed by your general practitioner or dermatologist. There are some tablet treatments that can be helpful in some people who experience really severe flushing from rosacea, and the ones I'm talking about here include clonidine and carvedilol, but you would definitely need to see a doctor to be prescribed these therapies. And finally, in terms of prescription treatments for people who have very severe inflammatory rosacea, which we often call granulomatous rosacea, we may sometimes use oral isotretinoin, which is a strong vitamin A related treatment, which we also use to treat severe acne. And finally, in addition to sun protection, gentle skincare, cosmeceutical ingredients and prescription therapy, we've also got to remember energy-based devices in maximising control of rosacea. So these treatments include vascular lasers and intense pulsed light, Clarisca, which is a new light-based treatment, and of course LED lights. So breaking that down a little bit, vascular laser and intense pulsed light can be really helpful for diminishing both the fixed redness that is often associated with rosacea, as well as flushing. So we find that when we decrease the redness that people have as a baseline, that they often flush less. But anecdotally, myself and many dermatologists also note that in patients who experience quite severe inflammatory rosacea will actually notice a significant improvement in this after being treated with vascular laser. So just a happy side effect of that treatment. In terms of soothing the redness, the inflammation, and as well as papules and pustules from rosacea, Clarisca, a new light-based therapy, can be really helpful, and it's often useful to have a sort of short induction course and then maintenance therapy to keep your rosacea under good control. And finally, to soothe redness and inflammation, we shouldn't forget LED lights, because these can be a wonderful tool to settle down what can be a really distressing condition. So a multi-pronged approach, and I'm sure there are lots of things that you may have questions about, so I'd love to hear from you, and please send me through via direct message or in the comments any of your questions. Thanks so much for listening. Stay safe.